this is Alithea, and today I'm going to talk about rare genetic diseases. So, did you know that rare people are born all the time, and there are around 350 million people on Earth who are living with rare diseases? So, what exactly is a rare disease? This is defined as any disease that affects a small percentage of the population, and there are more than 6,800 of these in the world. The exact cause for many rare diseases remains unknown, yet for a large portion it is due to mutations, which are changes in a single gene. And a gene is a heritable factor that consists of a length of DNA and influences a specific characteristic. Such diseases are thus referred to as rare genetic diseases. Many of these genetic mutations can be passed on from one generation to the next, which explains why they run in families. There are also environmental factors, such as diet, smoking, or exposure to chemicals, which play a role in rare diseases as they may directly cause it or increase the likelihood of being affected by it, and agents which increase the rate of genetic mutations are called mutagens. Now for some interesting examples. Firstly, Apert syndrome. This is a genetic disorder that affects around 1 in every 65,000 newborn babies. Usually, the parents do not have the condition, and the gene mutation occurs by chance. It causes the bones of the skull to fuse together before the brain is fully grown, and this pressure from the brain pushes the bones of the head and face out of shape. This brain compression can affect a child's intellectual development, and children with this syndrome typically have many surgical procedures as they grow. Apert syndrome also affects the hands and feet and a range of internal body organs. Typical features include a pointy head, a high, broad forehead, a sunken face with bulging eyes, fused fingers and toes, often with a single wide nail. Next, we have Ehlers-Danlos syndrome, which is a genetic condition that mainly affects the joints, skin, and walls of the blood vessels. People with this syndrome have very loose, flexible joints and stretchy, fragile skin, and some experience frequent dislocations, which often leads to pain in the joints. Distinctive facial features include a thin nose, thin upper lip, large eyes, and ears without lobes. There are no specific treatments for this, but symptoms can be managed through 1. Medicines to ease pain and reduce blood pressure, and 2. Physical therapy such as exercises or physical braces to keep joints strong and stable. Lastly, we have Prader-Willi syndrome, which is a rare genetic disorder that causes a range of physical, intellectual, and behavioral problems. It also has no cure but treatable symptoms. In babies, symptoms include difficulty sucking to feed and delays in learning to sit and crawl, all caused by weakened muscles, sleeping more than normal, and a weak cry. Children who are 2 or older experience an insatiable appetite which leads to excessive weight gain if not controlled. They are often short for their age, have small hands and feet, experience mild intellectual disability, have poor social and emotional skills, as well as behavioral problems such as mood swings. They also have light skin and hair compared with other people in the family, very flexible muscles, and a curved spine, known as scoliosis. As adolescents and adults, people with this syndrome tend to have breathing and sleeping issues and a lack of energy, and combined with an insatiable appetite, this can lead to life-threatening obesity. I hope you found this video insightful and informative, and be sure to return next week to hear about brain injuries.